Dr. Bake, this picture is really, really grim. Looking at the numbers in more detail, what is it telling you about where the third wave is going? It doesn't seem like we are levelling out at all, does it?
Not at all. I think that's really concerning when you can see the graphs overlaid, particularly related to the second wave. So, I mean, I think that we did see that those, the second wave was just so much greater than the first wave, and we saw that just rampant rise with that peak. And I think we'd hoped that, given that we hadn't seen any particularly new variants, that we might well have a slightly lower third wave, but that's not happening. We are seeing particularly Gauteng's third wave. Figures are already higher than the second wave, and I think that's particularly concerning. So it really is looking horrible. And remember that the pace at which the numbers are one thing, but it's actually the rate at which those increases happen to allow for the health services to cope with those cases. So it's the slope of the curve is as important as the actual number, and the slope of the curve is very steep, which means that our health services get overwhelmed.
This is very troubling indeed. The positivity rate is another indicator of how quickly the virus is progressing, and that's of how many tests, how many of them are positive. Today, it says it's a 23.7 positivity rate. So that's nearly a quarter of all tests that are being done are showing up positive, and there were over 46,000 tests done. The positivity rate should be 5% and below, is my understanding, to be in a safe zone.
Yeah. So positivity rate is important, but it's a factor of two things. One is the number of positives, but two is the number of tests being done. And so when we have high positivity rates, it really means that we need to be encouraging more people to test because they're negative, because they are symptomatic, so that we know that we are detecting the positives that are there. So what it means is, with having such a high positivity rate, it's likely that we are missing many more positive cases because that positivity rate is so high. So what you're really wanting to do is throw that net out wider and capture and be able to detect all of the positives. And the reason for that is that we want people to know that they're positive so that they stay at home and isolate and connect with their contacts so that their contacts can quarantine so that we can stop the spread.
Yeah. So what is left to do? You know, here in Gauteng, the Provincial Command Council on Coronavirus has been meeting to discuss the options. Professor Charles Parry of the MRC says it's too late, really, to do anything much, but to try and implore people to stay at home and not to gather. What do you think the options are for us as things just seem to get worse and worse?
Yeah. Look, I mean, the big challenge is, of course, we need to vaccinate. We've kind of almost missed the boat, but nevertheless, any vaccination is a positive. Of course, when you start to vaccinate in big numbers, it means that you potentially even creating a possible super spreader event at your vaccination sites. So you've kind of got to temper getting people vaccinated at the same time as making sure that you don't have large numbers, so appointments and making sure that you schedule and pace that vaccination so that people aren't congregating in big numbers. But I think certainly for Gauteng, this is a time to almost to not even talk about gatherings of 50, but actually just to eliminate all gatherings, because those are the events that spread quickly. Spreading at home is generally in small numbers. And those can generally be managed, but spreading at social events and at large workplaces, if people are gathering, it really needs to be curtailed dramatically and quickly.
Do you think that schools should close? You know, the Education Minister said, look, they're doing all they can to be safe and we want to keep education on track. But do you think that Gauteng schools at this point should be looking at a 2 to 3 week lockdown and a shutdown?
It's a very tough one. I think that the education sector has suffered and has such long-term effects for children going forward. I think that access and egress to schools is probably more important than at school. Certainly, I'm not aware of what the numbers are like on the ground at Gauteng in terms of school children, but certainly in the Western Cape we can see that very few children and even teachers are getting infected at schools.
Yeah.
So they're mainly getting infected in social spaces. Sure. So I think that, it's a tricky one, and I think that it does need to be that one needs to be decided at a local level based on
which is pretty much what they're doing. Yeah. So sorry to jump in there. I've just got very little time left, but I have to ask you about the deaths. 297 deaths. We're used to sort of around 100. What could this be indicative of? Is it that it might just be catch-up after collating figures from the weekend, or could this become our new normal, and is it a sign that our health services, our hospitals are getting overwhelmed?
It absolutely is. So, I mean, I think that there's a partial of a catch-up that it's such a big jump, but certainly, the number's there. And very importantly, what we need to remember is that when the steepness of the curve gets to the stage that it's almost vertical, at that point hospitals and health services are overwhelmed, and that means that beds aren't available, oxygen isn't available, and it means that ambulances aren't available to collect people, to take them to hospital facilities. And this is what we saw in the second wave as well, is that we just simply were overwhelmed and people were dying at home. And remember that many of our deaths are an undercount anyway, because deaths at home are not always there. We know from our excess deaths that it's more than double what our documented deaths are. So absolutely, we are going to be seeing more deaths. I think that we'd hoped that we would have been further along the vaccination schedule, so that we would be seeing milder disease and therefore less deaths. So even though high numbers of cases, that we might be seeing a lower proportion of deaths. But unfortunately, we're just nowhere near having vaccinated enough to be able to be seeing that difference yet.
Yeah, thank you so much for chatting to us this evening, Dr. Karen Begg, Public Health Medicine Specialist at UCT's College of Medicine. And just a reminder of those figures, 11,000 more people, just over, have tested positive for COVID, over 7,400 of them in Gauteng, 297 deaths in one 24-hour period.